there are thousands of different types of mushroom, some of which contain psilocybin as an active ingredient. Many people will know these as magic mushrooms. Professor Jo Neal works for Drug Science, which are a UK organisation researching the use of psychedelics to treat mental health conditions.
So let's be very clear what we're talking about here. So we're talking about medicine, and this is for very, very hard to treat conditions like PTSD, so that's post-traumatic stress disorder, and that is suffered by people who've had significant trauma in their lives. So we're also talking about disorders like treatment-resistant depression. So these are people who've tried every antidepressant, all the talking therapy, and maybe have depression for 30 years. There are medicines to treat these disorders available on the NHS, but for many people, those do not work. So what we want to do is enable patients to access medical psychedelics on the NHS without paying and without having to go out of this country.
Psilocybin is a Class A drug along with heroin and cocaine. It is also classified as a Schedule 1 drug, unlike heroin and cocaine, which means it has more restrictions when being used in medical research. Dr. Carenza Moore is a lecturer in criminology and security at the University of Salford.
I think it's very difficult to think about it, but basically classifications are political. They're not based on scientific evidence. They're based on a political decision at the time.
America's public enemy number one is drug abuse.
It's very hard to do clinical research on prohibited substances because they're Schedule 1 substances. So LSD, for example, MDMA. That's a bit different to the classification system. Scheduling deals with what you can and can't do in terms of clinical research. One of the things we've found is that a lot of research into psychedelics has been blocked either by governments and or because it's prohibitively expensive.
A statement from the Home Office says the Independent Advisory Council on the Misuse of Drugs is currently considering the subject of barriers to legitimate research of controlled drugs, including Schedule 1 substances, and recently held a call for evidence on the subject. Heroic Hearts UK is a charity which raises money to send veterans with PTSD to psychedelic therapy retreats. The CEO, Keith Abraham, served 9 years in the military.
When I came back from Afghanistan in 2008 and I began to realise that I was struggling and my behaviour was changing and had become quite unhealthy, psilocybin came into my awareness. And my experiences with psilocybin have definitely been healing. There's no doubt about it. Within the veterans community, for sure, there's still that stigma. Drugs are bad. We've always been told that drugs are bad. You need a sober mind. But when you leave the military, that same mindset remains. So it's actually quite a difficult job to try and convince veterans that this is actually effective therapy. There are many that would not be well served by psychedelics because the mind couldn't cope. But for the vast majority of people, if they have the correct preparation, mindset, and if they have the correct ceremonial setting, I'm so confident of the plant medicine being of a healing benefit to that person.
More research is needed, but without a change to the drug's classification as a Schedule 1 drug, this might not be possible.